In this video, I want to give you some tips about how to use Ozempic safely for weight loss. I'm Dr Shirley MD. Now, Ozempic is a great drug for weight loss if you use it properly. It has a lot of side effects, and there's been a lot of publicity lately about the side effects, so I just want to give you some tips how you can use it to be successful and reduce those side effects. So tip number 1 is go up the doses more slowly. Give your body time to adjust each dose. So the protocol that you have given may be to go very quickly to the maximum dose, but you can take more time, especially if you've been getting side effects. So stay an extra week at the lowest dose, an extra week at the dose above, until you get used to the side effects. You've got plenty of time, and so there's no need to rush up to the top dose. Tip number 2. You may not need the maximum dose. You only need enough to turn off your appetite so you can stick to a healthy diet. A lower dose means less side effects, less nausea, less constipation or diarrhea. So only go up to the dose you feel that you need to successfully control your appetite. Now, the way Ozempic works is that it slows down your gut metabolism. It slows down your gut movement. And so you feel full for longer. Your stomach takes longer to empty, so you feel full and you're not sort of driven to eat all the time. Now, some people feel hungry all the time, and so this works really well for those sort of people who are hungry all the time or always eating. So you only need to go to the dose that will turn that off. Now, the way it works in diabetes is it encourages your pancreas to make more pancreatic fluid and also insulin. And so it works really well for type 2 diabetes. But one of the things they noticed was it also slowed down this gut metabolism. Now, not everybody has this problem with being overweight. Some people have very little appetite and they can eat very little but still don't lose any weight. That's a different problem, and there's a different solution for that. But if you have a big appetite and you feel hungry all the time, then Ozempic is a tool that you can use to help you be successful in reducing your appetite and losing weight. Tip number 3. If you have a sluggish colon, if your stomach is slow to empty and you have constipation, you don't go to the toilet every day, you have a sluggish digestion, then you may get side effects sooner with Ozempic. So you may get reflux quite often because your stomach's not emptying. And you may get more constipation and really feel backed up and blocked and very unpleasant. So you may get those side effects sooner than other people. So it's very important for you to go up the doses more slowly and to take your time for your body to adjust. Tip number 4 is you do need to watch your diet. Despite what people say, Ozempic is not like a complete solution. It's a tool along with other things, and sometimes when people stop it, then they put the weight back on. Why? Because they haven't changed their diet. And really, there's no way around it. You have got to cut down on what you're eating and make healthier choices. There is no other way around it. Ozempic can help you get there, but you've got to put in a bit of work and start eating healthily. So that means more fresh fruit and vegetables, healthier meat, less processed foods, and definitely less sugar and fructose. Now, I'm going to make another video very soon about what you should be eating while you're taking Ozempic, and then how to carry on after that. That's going to be in the next video. You can't continue to eat lots of sugary foods and expect Ozempic to do all the work. It's not going to work that way because you're still going to be hungry because of the sugar, and I'm going to explain all that in the next video. So it's really important that you watch the next one. Now, tip number 5. If you suffer from anxiety and depression and you start taking Ozempic, your depression may worsen. So there is some evidence that people get a bit more depressed on Ozempic. Why? Well, it's to do with serotonin. 95% of our serotonin, which is our happy hormone, which keeps our brain happy, is made in the gut. And when you start taking a treatment like Ozempic, your serotonin level can go down because your gut's more sluggish, it's not working so quickly. And if you have depression, you may already have a low serotonin to start off with. And so taking the treatment might make your serotonin go even lower. Well, the good news is that you can offset that with some simple supplements. And again, in the next video, I'm going to explain about what supplements you can take to boost your serotonin so that you can take Ozempic successfully and not feel the symptoms of depression. The idea is to get down to your ideal weight, get some healthy eating habits, get yourself happy and relaxed, and then when you reach your ideal weight, then you can stop the Ozempic. There's very few people who have to take it for the rest of their days, but you do need to do it properly. Thank you for listening to this. Please watch out for the next video in a few days, and I'm going to explain lots more tips, lots more information about taking Ozempic safely, reducing the side effects, and also how to lose weight successfully. If you want to learn more, just click on the subscribe button and turn on notifications so you don't miss out.